2020 was a year like no other. The COVID-19 global pandemic dramatically changed daily life in ways none of us could have imagined. Here at UAMS, we adapted while staying focused on leading our state's efforts to combat the disease. As the pandemic spread to Arkansas, we quickly responded, showing how we are UAMS Strong.
I think this 2020 year, now coming into 2021, has been an incredible challenge for UAMS, but we have truly worked together to overcome the challenges that we have seen in front of us.
Like everyone else, we are dealing with a global pandemic, and we have to work through a lot of challenges working in healthcare. And so we have really risen to the challenge by working together.
Things had to change, right? And new processes had to go and be put in place. So it was really interesting working with UAMS, how nimble they were to adjust to the challenges.
So all the N95s and PAPRs and CAPRs that you see on the news and hear all about, our department's responsible for the training on those, for the fit test of those. And so, of course, the number of individuals enrolled in that respiratory protection program went through the roof.
The Human Resources Department partnered with the Little Rock School District on the opening of the UAMS Day Camp. That required all hands on deck.
Our employees really stepped up by converting our normal food pantry into a mobile food pantry so that we could get food to those that were quarantined, our staff and our students. And then also for our employees that were here at work working on the COVID floors and in our triage units, they weren't able to get away from their areas to go get food. So we started a food delivery program for them as well.
Usually we'll go to campus to recruit students, set up a different affairs and events, and it'll be in person. Due to COVID-19, we was unable to do that, so we've had to do virtual events.
Our team has been challenged with some of our staffing and the need to deliver services immediately on the spot.
Our department had to step up to the plate to combat this infection and virus, to make sure that we have a clean environment, not only for our patient, but for our teammates, the associates.
Every day we see that. You see personnel in every department taking on more. You see personnel in every department reaching out to help in different areas.
We're now giving vaccines, administering vaccines to the community. That says a lot. Not just its healthcare workers, but a community of people. So they say it takes a village. I think we're that village.
We had to be constantly helping with coordinating with new processes. So as you see today, the vaccine clinic is just one of those processes that we were pulled into and helping get everybody through and get them vaccinated.
A variety of teams came together to make that clinic happen. The service line couldn't have done that without everybody at this institution pulling together, working over the weekend, cleaning the environment over there, finding computers.
The vaccine clinic took us under a week to get that established, and that was definitely a feat. So when we opened up the 800 number to allow people to call in to schedule appointments, we were just inundated with calls. We had more call volume coming in than capacity of the phone system.
And we began that Tuesday vaccinating 10 patients every 20 minutes, and it ran like clockwork. And it's just incredibly heartwarming to see UAMS do something like this.
I found out that I was the 10,000th vaccine of the series, so it's a very exciting thing for me. I think this is a really important step for us. It's a really big milestone. I mainly got the vaccine here because I wanted to make sure that I was a part of preventing the community spread of COVID.
I have to be accountable, I have to be responsible, and I need to give all that I've got. So whatever I can do to add that extra layer of protection, it's my duty.
It's very important for me and for the entire community to get vaccinated so that we can spend time with those that we love, especially those that are immune compromised.
I believe it's important that we all do our part in overcoming this pandemic. So being vaccinated was one of the ways I could contribute to that.
UAMS came together as a team, worked as well as you could ever expect, and it made me proud to be a UAMS employee.
And we just have to work collaboratively with each other and support each other, and that's how we've gotten third.
We're willing to do those difficult tasks, and no matter how difficult those tasks are, and we do it with integrity, and we help others along the way.
Our community really pulls together to overcome the challenges and obstacles that we face so that we can meet the needs of our students, employees, and our patients.
UAMS Strong means to me that we are all in this together, that we're supporting each other, that we're lifting each other up.
Going the extra mile by identifying the yes in impossible situations. That's UAMS Strong.
I have never seen teamwork like I've seen here in this last year. It's just been phenomenal.
While this past year has been anything but typical, the UAMS commitment to excellence has never wavered. As we move forward in 2021, we still have much work to do. And we're confident that Team UAMS is not only ready to meet the challenges ahead, but exceed them.